Huntsville Hospital infectious disease specialist Dr. Ali Hassoun joins us now to talk more about the recent COVID surge. Thanks for joining us, Dr. Hassoun.
Thank you for having me.
Now, first of all, I want to start with this. We've heard a lot about monoclonal antibody treatment, being able to keep very sick COVID patients out of the hospital. Nobody seems to know it exists. Is it available for everyone? Do doctors offer it, or do patients need to know to ask for it?
So it's definitely been there for more than 6 months after the FDA gave it an emergency use authorization. It's actually since December almost. And where is it available? It's at the fever and flu clinic, in some of the walk-in clinic, as well as in Crestwood Hospital in addition. It's been shown it's effective, and we've seen benefit from reducing hospitalization if the patient receive it. But not everybody eligible for that. It's usually those who's at higher risk of progression to the disease. And it's not suitable if you end up admitted to the hospital on oxygen. So there's certain criteria that we follow that we give it in the outpatient setting.
Two top FDA officials stepped down this week, reportedly over a disagreement with the White House about the timeline for approving booster shots for the vaccine. Is this process being rushed?
I really don't think it's rushed. I think we do have evidence of some waning immunity. I think the vaccine is still effective, but our main worry, and it's been from the beginning, as there's more mutation, there is some escape of the virus from the efficacy of the vaccine. And that applied to a lot of other vaccines for other contagious diseases. I think it's going to need to be done because there is some data from other countries, as well as from what we have data about antibody level, admission to the hospital, those who's been vaccinated. So I think there's enough to recommend the boosters.
Let's talk about kids for a little bit. A year ago, children, we were told, weren't at risk. If they caught COVID, it wasn't going to kill them. How bad is it now for children?
So I don't think it's very bad, but it's definitely changed. So in compared to the Alpha variant, the Delta variant been shown it's more transmissible and affecting the kids more. If we look at the data, it's definitely higher, but as a percentage in compared to adult, it's still low. But it's concerning in the way of they are getting more infected, they are more likely to transmit it to others. So it's a method of transmission, and some of them are getting really sick. In compared to a year ago, we didn't see that as much.
I've asked you this question many times over the last year and a half, and I'm going to ask you again, when does this end? It seems like we're just going to have to live in some kind of perpetual pandemic mode. Do we have to get down to zero virus to return to normal?
So then, and honestly, I think it's up to the community, up to the leaders around, how to deal with the virus. We've said it from the beginning. There's a prevention method, mitigation strategies we need to follow if the virus is very active and surge. And now we have the vaccine, which is effective. Unfortunately, in both these, we still not really following it well. If we would have done a better job in following this, we've been able really to control it much, much better. I think there's still hope in following this and doing it, but we need to follow the right path to get it under control.
Dr. Ali Hassoun, we appreciate your candor, your insight. Thanks for being here tonight.
Thank you so much.